Historically, subjective estimate of left atrial size was the primary factor used to determine the severity of mitral insufficiency. Veterinarians without color flow or spectral Doppler on their ultrasound machines may have to continue to rely on visual estimate and right atrial to left atrial measurement. In a two-dimensional, right-side long-axis four-chamber view of the heart, the normal left atrium is usually a little larger, 2 to 4 millimeters depending on the size of the dog, than the right atrium, and the atrial septum is flat. If the left atrium subjectively appears larger than the right atrium and the atrial septum is flat, mitral insufficiency is estimated to be mild. If the left atrium is obviously much larger than the right atrium and the atrial septum is flat, mitral insufficiency is estimated to be moderate. If the left atrium is obviously greatly enlarged and the atrial septum bows into the right atrium, mitral insufficiency is estimated to be severe. Note the dilated pulmonary veins in this case. If symptoms of congestive heart failure are present, mitral insufficiency is advanced severe. Unfortunately, most cases of mitral regurgitation do not fit neatly into mild, moderate, or severe stages. Many cases are somewhere between mild to moderate or moderate to severe. Use of color flow Doppler, spectral Doppler, and a few other cardiac measurements help to more accurately stage mitral insufficiency and guide treatment. Multiple parameters that support each other make a stronger case for a particular stage of mitral insufficiency. Color flow Doppler can be used to help estimate the stage of mitral insufficiency in a dog with a central jet in the right side long axis four-chamber view. A central mitral insufficiency jet flows retrograde through the mitral valve leaflets and parallel to the atrial septum. The color flow box should cover the entire left atrium, and the Nyquist limit should be set between 50 to 60 centimeters per second, if possible, for this appraisal. A mitral insufficiency or regurgitant jet that fills less than 20% of the left atrium is considered mild. A jet that fills 20 to 40% of the left atrium is considered moderate. A jet that fills more than 50% of the left atrium is considered severe. A central mitral insufficiency jet cannot be measured with continuous wave Doppler from the right side long axis four-chamber view. It is best measured from the left apical four-chamber view. If the mitral insufficiency is primarily due to partial prolapse of the anterior or septal mitral leaflet, the one closest to the transducer or septum, the regurgitant jet tends to be directed towards the left atrial free wall. In this case, the percentages described for a right side long axis four-chamber central jet do not apply. The eccentric jet tends to hug the left atrial free wall and not disperse with as much turbulence. An eccentric jet that extends only to the left atrial free wall is considered mild. A jet that curls along the free wall to the first pulmonary vein is considered moderate. A jet that curls along the free wall and extends past the first pulmonary vein is considered severe. An eccentric mitral insufficiency jet can be measured with continuous wave Doppler in the right side long-axis four-chamber view. The continuous wave Doppler cursor can be placed in the main jet from this angle. Color flow Doppler can be used to help estimate the stage of mitral insufficiency in a dog with a central jet in the left apical four-chamber view. The color flow box should cover the entire left atrium, and the Nyquist limit should be set between 50 and 60 centimeters per second if possible. A mitral insufficiency or regurgitant jet that fills less than 30% of the left atrium is considered mild. A jet that fills 30 to 70% of the left atrium is considered moderate. A jet that fills more than 70% of the left atrium is considered severe. A central mitral insufficiency jet is best measured from the left apical four-chamber view. The continuous wave Doppler cursor can be placed within the main jet. Continuous wave Doppler can be used to measure an eccentric jet mitral insufficiency from the right side long-axis four-chamber view, or a central jet from the left apical four-chamber view. The pulse repetition frequency should be increased to raise the Nyquist limit to 100 centimeters per second, or as close as possible, to help identify the main regurgitant jet. The jet should be positioned so that the continuous wave cursor can match the angle of the jet for the most accurate measurement. The density of the continuous wave envelope can be used to estimate the stage of insufficiency. If the envelope of each regurgitant jet appears faint or incomplete, the insufficiency is considered to be mild. It is difficult to keep the continuous wave cursor in the regurgitant jet. If the envelope seems complete but is not as dense as the mitral forward flow, the insufficiency is considered moderate. If the envelope is complete and as dense as the mitral forward flow, the insufficiency is considered severe. The regurgitant hole is large, and it is easy to keep the continuous wave cursor in the regurgitant flow.